young hearts at risk? Well, a recent study has shown that there has been a 40% rise in heart attacks among the young in the past 1 year. And in the past 1 year, there have been multiple instances of young adults, teenagers, and even children. A boy as young as 12 years of age actually died at home in Gujarat's Rajkot this year. Multiple such heart attacks have been reported in Gujarat, and these are very concerning because this hints at a larger lifestyle challenge that we are looking at right now. And young hearts being at risk is a serious sort of risk to the country's economy as well. So there are multiple ramifications. But let's get to the core of the debate. Why is it actually happening? What is the solution? And what are the risk factors? Joining me now on the program, Dr. Rakesh Verma, who's a former Additional Director General of Health Services at Government of India. Also with us, Dr. Ashok Seth, who's the Chairman of Fortis Heart Institute. Thanks very much, doctors, for joining us on NDTV. Let me go across to you, Dr. Ashok Seth, first. Why are young hearts at risk now more than ever? Now, this is a larger lifestyle challenge, as I said, that we're looking at because there's rising diabetes, rising hypertension, high levels of cholesterol, stress, anxiety, multiple reasons. But according to you, why is it now that we are seeing such a massive risk?
So let's just point out that heart attacks are multifactorial, and you've really elucidated that very clearly around the lifestyle changes which have happened. We've seen a growth of heart attacks in young individuals over the last 15 to 20 years. And you're correct that it's much more noticeable in the last few years. And that's multiple reasons, of course, that they are visual now a lot more than they were noticeable before due to a lot of social media that we actually see it. But clearly, two important risk factors have emerged more recently. We talk about smoking, diabetes, hypertension, lifestyle, obesity, and all that has changed over the last 15 years. The most two recent ones, of course, have been COVID. And we've well understood that there's been a double increase of the incidence of heart attacks, perhaps 300% increase of the heart attacks in those who have had COVID. That has been well demonstrated over the subsequent year. And second, of course, is that we do not understand or we are not focusing on the effects of pollution on inflammation of the heart arteries, and it's a very important risk factor which has been developing in the recent times. You just saw, those visuals of massive traffic jams, and look at the amount of fumes that we actually breathe in our cities, and sulfur dioxide, carbon monoxide, all are inflammatory to the heart. And the youth is the one which is traveling on those roads, on the streets, in those fumes. So I think we've got two important risk factors now added on.
Dr. Seth, that it's not just to do with your personal habits, but the larger toxic development that we are seeing, that has got to do a lot with such ailments and such sudden heart attacks.
Which also includes COVID.
Absolutely, and that is something that the medical, the health ministry also said that the link between COVID and heart attacks is something that they're looking at. But Dr. Rakesh Verma, let me get you in on that. What are some of the signs or some of the things that should worry you as youngsters? Because these cases that we look at, these are extremely normal activities that these youngsters were doing, whether it was working out or whether it was dancing, whether it was being at work or at home or in a classroom. What are some of the trigger signs that should actually worry you?
What are the biggest missing thing is they're not warming up. One point which they must realize that the youth wants everything in a lift, everything in a jump, everything very fast. They don't realize there is some period known as learning phase or warming up phase. Before they go to the gym, they should warm up. They should walk for about 10 to 12, 15 minutes, warm up their muscles, warm up their limbs, and then go to the weightlifting machine or treadmill. They want a treadmill also to wear gradient 4 and full speed. Instead of starting from level 0 and very slow speed, then they should add up the speed and elevation both. They want is everything in a jerk. If you want to see on the roadside, people start their motorcycles or their bikes or their scooters, and from 0 to 70 or 80, they want in a moment. It is the warming of phase which they are missing. Every machine, including heart, including our body, is a machine. Heart is a pump. It requires warming up. Instead of waiting for that warming up, they straight going for harm. Yesterday's news, which somehow came to my table also, this some gentleman who was playing cricket in Meerut city.
Yes.
He hit 4 sixes, and then before the 7th six, he was collapsed. He said chest pain, and by the time he was rushed to hospital, hospital says he's brought dead. So instead of waiting for his turn, he said in only 1 hour I must hit 6 sixes. No, that is not correct.
Right. So you're hinting at a larger lifestyle pattern, Dr. Verma. That's a very important point that you make there.
Yes,
because everything has to be gradual.
Second is over competitiveness.
Yes, whether it's losing weight.
It has to warming up, very, very gradual. We have to over.
Yes, whether it's losing weight, whether it's exercising,
also.
Everything has to be gradual. Dr. Seth, there's one study, and we have that graphic up right now on your screens. One ICMR study actually says that 55% of the heart attack deaths were actually reported at home. So what do we do in such a situation? Because a lot of us are actually not trained. Most Indians are not trained in CPR, in an immediate response. So what do we do when such a situation arises at home?
So this is, perhaps you've hit the nail on the head, but just before I get to this, I want to emphasize that gymming and heavy weightlifting and severe running and extreme exercising is not necessarily the same as heart-healthy exercises, which is aerobic exercises, which only means 200 minutes of brisk walking in a week. So we must differentiate gymming and heavy weightlifting from heart-healthy exercising. The second point is, of course, severe extreme exercise can precipitate heart attacks, and we should be wary of that and gradually build up towards a stamina which can allow us to do that.
Right.
Coming really to your point around what can we do, it is imperative for all of us, especially those whose relatives have heart disease, to actually learn basic cardiopulmonary resuscitation. There's no question, and by the way, it is very simple. If I was to take you to even a video, and there are hundreds of them, all you got to do is make sure that the time a patient collapses at home, and by the way, we've already known this factor that bystander resuscitation, which means if I was standing there and somebody collapsed in front of me, I have a 60% chance of saving his life if I exactly knew what to do. And that's very simple, that you lie him flat on the ground. You make sure in the next 10 seconds that he's actually not responding to you. You ask him for that 10 to 15 seconds. Make sure that you have a second person to call for help. Therefore, he gets help. And at the same time, compress the center of his chest at 100 pressures per minute.
CPR training is a must, whether you're a school-going child or whether you're a college-going boy. CPR training is a must. I'm afraid I'm running completely out of time. Doctor, sorry to cut you off there. But let me get Dr. Verma in very quickly. Dr. Verma, at a government level, what must we be doing?
Yeah. See, I must tell you, while I was holding that portfolio, we have recommended to the government of India, and which is under the legislation or rules are being underframed, that all uniformed services, that includes ITBP, CRPS, CIFSF, their sub-inspector level and inspector level officers will be mandatorily be given the CPR training, roadside resuscitation training.
Right.
Because we start from there, and then we have to cultivate as much as 40% of our population to be trained in CPR on the roadside, on an auditorium, on a school and everything. And I can assure you, government is very, very confident of implementing this code in next 3 to 4 years.
Okay, that's
and I'm
good
very
news
happy
there,
and thankful to NDTV
Dr.
for bringing
Verma,
up this
because
nice
awareness
issue.
is key. Awareness is key when it comes to such diseases, such a lifestyle challenge that we're dealing with. Thanks very much, doctors.
Automatic external defibrillators should also be available at all busy points, which is lacking in our country.
Thanks very much, doctors, for joining us on that very important debate. Young hearts at risk, what do we really do?